Hi, I'm Dr. Jeffrey Ogden. I've been practicing general internal medicine in Orem, Utah for over 26 years. In the last 10 years, I've been focusing primarily on becoming the best preventive medical practice possible while promoting healthful lifestyle changes for my chronic illness patients, such as those with diabetes, high cholesterol, and obesity. As a practice, we have achieved five-star status on most of the HEDIS quality measures. As a recognized innovator in cost-effective healthcare, I have been teaching other physicians how to engage their patients through a comprehensive annual wellness assessment, which includes technology on a diagnostic cart. The nation's insurers are encouraging and reimbursing well for this type of annual assessment, but providers fail to implement this service into their own practice, thus leaving precious dollars on the table while providing suboptimal care for their patients. I had to ask myself, why? Well, I believe the problem is time. You see, I developed my technology card over a several-year period, spending countless hours deciding on the best screening strategies for my patients, researching the various brands, and gradually incorporating these technologies into my own practice workflow. Today's busy primary care providers do not have the time to research and implement new technologies for themselves. These core screening technologies, however, are now available on a single diagnostic cart, SmartCartDx, that is immediately usable by the primary care provider with everything pre-installed, pre-configured, pre-financed, warranted, and ready to roll, along with training, billing, and clinical support, making the implementation of new technology immediately operational and, very importantly, immediately reimbursable. All of this is bundled and supported at a price that you would expect to pay if you purchase these items from your usual medical supply sources individually. No one else, however, is offering anything like this type of service, and definitely not at this price. These technologies are appropriate for screening use for all adults over age 50 at their annual physical and reimbursed at around $700, depending upon your insurer mix. You likely perform these adult physicals about 30 times a month on average. That means you can boost your office revenue by about $21,000 each month at about $2,000 cost, simply by adding these important screenings. You see, implementing these screenings into the annual wellness visit has been proven to improve patient compliance with medication and lifestyle recommendations, reducing the total cost of care. We at Achieve Health are averaging nearly $3,000 per person per year savings for our Medicare patients. Extrapolated to the entire Medicare population, that would yield about $180 billion in savings each year. Well, that's great for the patient, awesome for you, the provider, and a phenomenal boon to our healthcare system. That's what I call a win-win-win. I want you to reap the benefits of these technologies for yourself and for your patients. So here's the offer. I will bring a cart personally to your office and perform these services on 2 of your patients at their annual wellness examinations. It takes about 35 minutes to complete. I help you with clinical questions. Our billing team helps you bill their insurance for those services, and you keep the reimbursements. Why would I do this? Because I know that once you see success with your patients, you will want a cart of your own ASAP. Call me at the number below to schedule your reimbursable in-office demo.